Yeah, so this is a study that we're very interested in and very excited about. So as the audience knows, the IDH1 inhibitor Ivosidenib and the IDH2 inhibitor Enasidenib have been approved as single agents for relapsed and refractory acute myeloid leukemia. We're not satisfied with that. We think these drugs need to be moved into the upfront setting. So what we did is we did a study, non-randomized study, to show that you can combine the IDH1 inhibitor with chemotherapy and the IDH2 inhibitor with chemotherapy, and you can do this safely. So that's what we did. We took patients who had newly diagnosed acute myeloid leukemia, either with an IDH1 mutation or an IDH2 mutation, and we gave those patients either the IDH1 inhibitor Ivosidenib with induction chemotherapy, 7+3, 7 days of cytarabine, 3 days of idarubicin or daunorubicin, or for patients with IDH2 mutations, we gave them the IDH2 inhibitor Enasidenib in combination with 7+3 induction chemotherapy. After the patients had completed induction, if they were in a complete remission, they could go on and get consolidation chemotherapy with the IDH inhibitor they had been assigned to based on their mutation. And those patients who were in a continued remission could then go on and get maintenance therapy either with single-agent IDH2 inhibitor or single-agent IDH1 inhibitor. Now, at any time, if the doctor said, you know what, we think that you're in remission, you should have an allogeneic bone marrow transplant, that patient was allowed to come off of the study, have their bone marrow transplant, and they weren't followed anymore. They were no longer on the study. So what were the results that we saw? Well, the results I think were quite exciting. We know from other data that has been presented at this meeting that if you just give patients with IDH1 or IDH2 mutations straight up induction chemotherapy, their remission rates are about 40% if they're older than the age of 60. In this study, when we combined the IDH1 inhibitor or the IDH2 inhibitor with chemotherapy, we saw response rates, remission rates in the range of 70%. It was a little bit different between the group that got Ivosidenib and the group that got Enasidenib, probably related to different disease biology in the IDH1 versus the IDH2 mutated population. But we think that that is a major improvement over what is seen in the historical data. Finally, what I'd like to say is that this shows that you could do this safely. It shows some preliminary evidence of efficacy, but we want to take the next step. And the next step is to do a placebo-controlled randomized phase 3 study where you randomize patients either to getting Ivosidenib for IDH1 mutant patients with chemotherapy versus placebo with chemotherapy. You do the same thing for patients with IDH2 mutations with Enasidenib, and then for induction consolidation. And then at the end of the day, you'll be able to see which group has the higher overall survival.